Hello, my name is Dominique. I'm going to be your student nurse today doing a head-to-toe assessment on you. First, I'm going to perform hand hygiene. For your privacy, I'm just going to close the door. Just for verification, can you tell me your name and date of birth for me?
Brianna Griswold, 1998.
Perfect. And what brings you in today?
Just a general checkup.
Okay. Are you having any problems? Any kind of that we need to know about?
No, ma'am.
All right. So I'm just going to do a head-to-toe assessment on her. And while she is generally talking to me, I'm just going to be assessing her just generally. So I'm going to look at her skin. She's tan. I don't see any obvious bruising lesions. I'm also looking at her posture. It is erect. I'm also going to look at her nutritional status. I'm also listening to her voice, and it sounds appropriate. She's having no problems articulating. I'm also looking to see if there's any edema going on. She doesn't have any. I am going to be inspecting her mood and her affect, and I'm also going to be looking at her personal hygiene. She seems appropriately dressed. She doesn't have any odor. I could also inspect her breath whenever she was talking to me. So now I'm going to move on with asking her her weight. What is your weight?
166.
Okay, and how tall are you?
5'4".
So I can also get a tape measure and also measure the circumference of her. And from this information from her height and weight, I will get her BMI, which is 28. Now I'm just going to be getting your vital signs. So I'm going to check her temperature. Okay, and then I'm also going to check her blood pressure. And I would check it. I would listen for the first and the last pulse, and that would give me her blood pressure reading. I'm going to be feeling for her pulse. I'm just going to use the clock on the wall. While I'm feeling for her pulse, I also can be looking at her respiration rate. Okay. Are you in any pain right now?
No, ma'am.
Okay. So her blood pressure was 120/80. Her pulse was 68. And then her respirations were 18. And then her temperature was 97.8. And she's in no pain at 0 out of 10. So now I'm just going to first begin by inspecting her head. So I'm going to inspect her scalp. Are you having any, are you noticing any tenderness anywhere on your head?
No, ma'am.
I'm just going to inspect everywhere. And you just let me know if anything hurts. Okay. And I'm looking for any lesions, any bruisings, any kind of sores. I'm also looking for any kind of residue in her hair. She has a dry scalp. So now I'm just going to inspect her face. So it is normal cephalic. Everything is symmetrical. I'm going to palpate her sinuses, frontal and maxillary. I'm also going to palpate her temporal artery. +2. I'm also going to check for TMJ. If you will, just open up your jaw and close down. Just seeing if I feel any crepitus. And if you will, just clench down for me. Perfect. Okay, now I'm just going to inspect her eyes. With her eyes, I'm looking to see if she has any drainage, discharge, any redness. I can also, her sclera is white. I'm also looking at her conjunctiva. It's pink, moist, no discharge, no drainage. Now I'm going to perform, if I were to have a Snellen chart, I would have her stand 20 feet away, and I would have her cover one of her eyes, and she would read to me a couple lines. She would start at the lowest one that she could read, and then we would, based on that, if it was 20/20, then we would go to the other one, and she would do the same thing. She would read the line that she could read, and then we would move up and down. All right, and I'm now going to perform a visual acuity test. This is just looking at her peripheral vision. So if you will, just cover one eye for me and just look straight ahead and tell me what number you see.
1, 2, 1, 2.
Okay, now cover the other, and you're gonna do the same thing. Just look straight ahead.
1, 2, 1, 2.
Perfect. Okay, so now I'm going to be checking her extraocular movements of her eyes. So if you will, just follow my pen, and this is checking cranial nerve 3, 4, and 6. Perfect. I'm now just going to check for Perla. This is just checking if her pupils react to light and accommodate. So if you will, just cover one eye for me. Look straight ahead. Perfect. I'll cover the other one. And they do. They both accommodate to light. So now I would be looking, if I had an ophthalmoscope, I would look at her lens, her optic disc, and then the vessels in her retina. So her optic disc should be pink, intact, and it should usually, it's like a yellowish red pink color. And I would also be observing the vessels around it to check for any hemorrhaging. And now I'm going to inspect her ears. So as I'm looking to see if there's any drainage, any tenderness. I'm looking at her auricle. Are you hurting any?
No, ma'am.
Have you had any hearing issues?
No, ma'am.
Okay. So I would look with the otoscope, and I would look at the inside of her ear, and specifically her tympanic membrane. So check to make sure her tympanic membrane is intact and that it is pearly gray in color. I'd make sure it's not inflamed, red, or pale. So next, I would perform a hearing test on her. So this is just the whisper test. So I would stand about a arm's length behind her. And if you will, just cover one ear and repeat the letters and numbers after me.
T, 4, 6.
Okay, and now just cover the other one.
2T6.
Perfect. So, and she did hear it well. She heard all of the numbers and sounds. So next, I'm going to just inspect your nose. Have you been having any breathing problems?
No, ma'am.
Okay, so I would just look for symmetrical, and it is symmetric. I would palpate. I'm also going to take a look at the inside of her nose. There's no drainage. Now I'm just going to take a look at her mouth. Have you noticed any sores, any toothaches?
No, ma'am.
Any trouble swallowing?
No, ma'am.
Okay, if you will, just open your mouth for me. And I'm just looking at her dentation. I'm looking at her mucous membrane. She doesn't have any lesions, any spots. She does have all of her teeth. They do look intact. It is moist and pink inside. I'm also going to look at her gag reflex and her tongue motion. So I'm checking cranial nerve 9, 10, 11. Will you say ah for me?
Ah.
Okay, and I'm looking at the uvula motion. If you will, just stick out your tongue for me. Okay, and now move it side to side. Okay, perfect. So now I'm just going to inspect her throat and her neck. So I'm going to be checking her lymph nodes. So I'm going to do the preauricle, postauricle, her tonsillar, her submandibular, her submental, her cervical, and then her supraclavicular. Okay. I would also be inspecting her thyroids. You can also do this from the back as well. I'm looking for her trachea to make sure it is midline. So I'm just going to feel one side, and then I'm going to feel the other side. Okay. So now I'm going to have her do her upper extremities. So if you will, just raise your arm for me, and you can put it down. And this is, we're just checking for her flexion, extension, and abduction and adduction. So you're going to go to the side, that's abduction, and then go back, that's adduction. And then I can also check her pulses. Okay, and I'm just feeling for her brachial, now her radial pulse. And I'm inspecting her skin as well as I'm doing this. I'm going to check her capillary refills. They're all less than 2 seconds. Okay, and if you will, with your elbows, flexion and extension. Perfect. And now with your wrist, you're going to do pronation and subnation. So just go back and forward. Perfect. And now with your wrist, you're going to do flexion, extension, hyperextension. Okay. Perfect. And I do not notice any clubbing of her nails. They are pink as well. So now I'm going to take a listen to her, and I'm going to inspect her thorax. I'm going to percuss and palpate. So I'm going to start back here on her posterior. I'm first going to inspect her back. So I'm just going to pull up her shirt a little. And if you will, just turn to the side for me. Just so you can see. Okay. So I'm just watching her breathe in and out. Take deep breaths in and out for me. Okay. Take another deep breath in. And I'm feeling for symmetry to make sure it's symmetrical. Her inspiration, expiration. Okay. Now I'm just going to percuss and do tactile affirmatives. So first with tactile affirmatives, I'm just going to have her say 99 each time I move. All right, you can start.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
And it is her tactile affirmatives. It is equal bilaterally. Now I'm just going to listen with percussion. Okay, and it's heard Renaissance. Now I'm just going to take a listen to her. I'm going to be listening for any crackles, any diminish, any fine crackles, any wheezing. If you will, just take a deep breath for me. Okay, she sounded clear in all quadrants, in all areas, in her upper lobe and lower lobes. Now, I'm now going to do CBA tenderness. I'm just going to go down to the 12th rib, and if you will, just tell me if you have any tenderness. Feel okay? No tenderness? Okay.
Correct.
Now I'm just going to listen to, you can turn back to the front. I'm going to do the same. I'm just going to inspect her chest. Make sure there's no lesions, bruisings, any moles, any redness, looks okay. So I'm going to do the same with the tactile affirmatives and the percussion, and then also listening to her. So if you will, just say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, I'm just going to percuss. Just let me know if you have any discomfort. And it is Renaissance. I'm going to listen to her. Are you having any shortness of breath?
No, ma'am.
And if you will, just take a deep breath in and out for me. Okay. And it was clear in her upper lobes and lower lobes. Okay, so now I'm going to do her breast exam. So I'm just going to palpate around. I'm going to inspect and palpate, and I'm also going to palpate her lymph nodes in 2 positions. So if you will just lift up your top a little. Okay, so I'm just going to palpate. And have you noticed any tenderness or any kind of discoloration, redness, drainage?
No, ma'am.
Okay, so I'm just gonna feel. I'm gonna do the linear. Or you could do the circular motion as well if you wanted to. I'm just feeling for any lumps anywhere or any hard nodules. Okay, if you will, just extend your arm. And feeling for any lymph nodes. And then I can go back and feel a little. Just make sure there's nothing different. Okay, and if you will, just press your hand against your hips. And I'm also going to feel for any lymph nodes as well in that position. Okay, and you can put your shirt down a little, but I'm gonna still need it just to inspect your abdomen and everything. All right, so we're now going to do her cardiovascular assessment. So I'm just going to be looking to see if there's any JVD, which is just her jugular veins, if there's any kind of distension. And I'm also going to, and she doesn't, and that could indicate like heart failure. And then also I'm going to be looking to feel her pulses, her carotids, and I'm just looking to see if I can see any visually. And I'm gonna feel carotids one at a time. And +2. And +2. They feel good.
Mm-hmm.
Have you had any heart problems in the past? Any kind of palpitations?
No, ma'am.
Any chest pain, fatigue, weakness? Okay.
No, ma'am.
I'm now just gonna listen, see if I hear any bruise.
I'm sorry, I had a yawn.
Okay. So I am going to inspect your chest just one more time. I'm just gonna look to see if there's any heaves or any thrills. And that's just whenever you can visually see your heartbeat. And I don't see any. All right, and we're gonna locate the PMI, which is gonna be the 5th intercostal space. And just let me know if I'm hurting you.
Okay.
So the PMI will be right there. And I'm also gonna listen to you there. rate's more controlled. So now I'm just going to listen to her heart sounds, and then I'm also going to go back and listen to them with the other side of the stethoscope. So first I'm going to start at the aortic. Pulmonic. Second pulmonic or Erb's point. Listen to the tricuspid. And then mitral. And then you can also listen to the epigastric area as well at the end. So I'm just going to flip around. Going to repeat, going back up the opposite way, starting with her epigastric area. Then her mitral. Her tricuspid. Her Erb's point. Or second pulmonic. Pulmonic. And aortic. I could also have her lean up for me, and just if you will, just lean up for me a little and listen for any heart murmurs. Okay. All right, so now I'm just going to inspect her abdomen. I'm just looking to see if it is symmetrical. Notice there if there's any kind of moles. She does have one right there and right there. And then also I'm looking to see if she has any distension going on. When was your last bowel movement?
Today.
Today? Okay, and was it normal? Was it light brown, soft, hard?
It was normal.
So it was soft and brown. Okay. So I'm just, after I inspect, it is symmetrical. She is symmetrical and round, just the normal. And now I'm just going to listen to her, percuss, and then palpate. I'm going to start the right lower quadrant. And I listen to see if there's any bowel sounds. If I don't, I have to listen for 5 minutes. And then after 5 minutes, you could determine that a patient doesn't have bowel sounds in that quadrant. Okay, and she does have bowel sounds in all 4 quadrants. And now I can also listen to her arteries. So I can listen to her aortic artery, her renal artery, and then also her femoral artery. I'm just going to do one side. We make sure we don't hear any bruise. Okay, don't hear any breathes. Now I'm just going to percuss in all 4 quadrants. And it is tympani. And now I'm going to palpate. I'm going to start with the light palpation, and then I'm going to go on with the deep palpation. And then I'll also palpate her liver, her spleen, and then also her kidneys. So I'm going to start off with light palpation. And you're not having any pain or tenderness anywhere, correct?
Correct.
Okay. I'm just going to start. Okay, and now we do the deep palpation. Okay, now I can feel for her liver over here. Get her liver span, then also feel for her spleen over here. And then also palpate her kidneys. They're not palpable. Okay. Are you having any urination problems? Any burning?
No, ma'am.
Okay. Any frequency? Odor?
No, ma'am.
Okay. So we could do a examination, a genitalia examination on her, and we could just look for any discoloration, any abnormalities, any kind of there's like any warts or any kind of moles. We could all look at that, or any discharge. So now we are going to go with the legs, her lower extremities. Okay. So I'm first just going to inspect, like always. So I'm looking for any kind of redness, any swelling. I'm also looking at her veins to see if she has any varicose veins. And I don't see any. I'm also looking at her feet. I'm looking at her toenails, make sure that there isn't any clubbing of them. No. Okay, now I'm just going to palpate your pulses. I'm just going to start at her popliteal, since we listened to your femoral pulses earlier. Making sure they're bilateral. Listen to, feel the posttibial. And her pedal pulses. While I'm feeling her pulses, I can also be feeling for the temperature of her skin. Her extremity, the upper part of her leg is warm, and then her feet are cold. Now I can do some range of motion with her. So first we are going to do, if you don't mind just sitting down on the couch for me. Okay. And if you will, lay down for me on the couch. And we are just checking for the range of motion in her hips, her knees, her ankles and feet. So we're going to do flexion extension. So first you're going to an adduct and abduction of the hip. So if you will, just bring this leg outwards like you're kicking to the side, and then back like that. And that's abduction and adduction. She's done that fine. And now we're going to do flexion extension. Perfect. And we can also be checking for the knees as well, flexion and extension. And now we are going to look at her ankles. Yeah, you can sit back. And we're going to do flexion, extension as well. Dorsiflexion, dorsiflexion. Okay. And if you will, just spread your toes out for me and put them back together. And back. Okay. I'm going to check to see her Babinski reflex. That's just where I will put an object against her foot, see if her toes curl. And they don't. And now I can check. You can sit back up for me. I can check for her deep tendon reflexes. So I will start at her arms. So we're going to do the bicep. You'll just have her relax her arm like this. And then you would take the object and hit it right here. Perfect. And now you're going to do the radial one. You can just relax for me. And we'll do the same. Okay, and then we'll do the radial one. Okay. And you should see a slight movement, but it shouldn't, it should only happen one time. It shouldn't repeatedly go, or that could be a sign of clonus. So then we're just going to do this one side, and now I'm going to do the deep tendon reflexes for down the bottom. So we're going to do the patellar reflex, and you would take that same object and you would hit it. So we're going to, and then we could do the other side if you wanted to. And we can do, if you will, we could do the back of her foot, the back of her leg as well. And this is just checking her Achilles. And then you could have the patient as well turn over with their feet hanging down and then do the same thing as well. So now I'm just going to be doing stereotenosis. And I'm checking to see if she's going to do the neuro assessment on her as well. So she already told me why she was here and what she was here for. And she told me her name and date of birth, so she is alert and oriented ×4. I'm going to have her tell me I'm going to check all 4 extremities and see if it's a soft object or a hard object hitting her. And we can do a sharp object as well. And can you close your eyes for me and tell me if this is soft, hard, sharp?
Soft. 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 Soft.
Perfect. Okay. And now, with your eyes still closed, can you tell me which extremity I'm touching? By saying left arm, right leg, left leg.
Left arm. Right leg. Left leg. Right arm.
Perfect. Okay, and now, still with your eyes closed, I'm going to place something in your hand, and you just tell me if you can determine what that is. Okay.
It's a hair tie.
Perfect. And we'll do that again for the other side.
It's a hair tie.
Okay. And now,
is change.
Now for this side.
Change.
Okay, perfect. You can now open your eyes. So she did have stereotypes, or she did identify each object correctly. So now we are going to have her stand up for me. And we are going to, I'm just going to look at her posture. And I'm going to have you, if you don't mind, just put this heel to the shin and go down with your, yeah.
Like this?
Yeah. Just go up and down. Up and down. Okay, and back to the other. Okay, and now if you will, just place your arms out in front of you and then close your eyes and point your hand to your nose. Okay, and now for the other one. Perfect. Okay, so now we're going to have her do the rapid movements. So that's just where you're going to take your arms in front of you and then just go up, down. And we're just checking for their alternating rapid movements. Now we are going to perform the Romberg test. That's just where she's going to go heel to toe and walk towards me. And we're looking for any swing, any off balance. And she does perfectly fine. I'm also looking at her posture as she is walking as well and her movements. Okay, perfect. Now I'm just going to have her, if you will, just lean over on this side and just kind of move over. Yeah. Perfect. Okay. Alrighty. Well, I think that ends your test. Do you have any questions for me?
I do not.
Alright, well you can have a seat and someone will be back in with you. And I thank you for letting me do my assessment on you. And if you need anything, you just let me know, okay?
Thank you.
You're welcome.